Hey everyone, welcome back to the last module of Dhanwantri. Today we will be talking about how to clear OPDs fast and how to manage or how to put rather intra-department referrals and a few other things if missed will be included in this, and we'll conclude with Dhanwantri Module. So let's get started by going to PSIC gateway and using our credentials to log in. From here we'll go to health information system. We will be selecting our location and facility, and we'll be going to doctor's work list. So as we can see, we have a lot of patients over here which have not been seen. Basically what happens if you did not open the case sheet, be it mini case sheet or check-in number, if you didn't add any diagnosis, it shows us this as an open OPD token. Now a lot of times the patient does not come up. In some departments you are supposed to clear all of this, basically just clear the OP list so that you will have a clean list. So basically generally what we do is we open mini case sheet one by one, and then we go down and then we put a space bar in the description and then save it so that you have something in the description and that the OP is cleared. So Rebecca, if you refresh, Rebecca will be shifted to the side, the consultant specific. In order to do it fast, what you can do is you can have this side by side system. Once you have opened the tab side by side, I want to hold your control button and then click on the mini case sheets one by one, and if you see that, it will be opening directly over here. So you can click on these and you can open all of these. Suppose if you want to open a full page of this, you can open a full page. Now what you can do is you can use these shortcuts which are available in all of the browsers. If you put Control T, it shifts you to the other tab. Yeah. So if you do Control T, it shifts you across different tabs. So what you can do is you can decrease the size of the page so that all of it is visible in one single page. If that's too small, you can click it. Our main goal is to do it as fast as possible. And then you put your cursor over here, you put a space in the description, you save, and then you wait for the loading screen. Once it shows record saved successfully, you press Control and Tab, and then it shifts. As you can see, it shifted, and then again I'll do the same thing. I put space, I save, and then Control Tab, space, save, Control Tab. So in that way we cleared 3 OPs in as fast of pace as possible. And if you have multiple tabs open, you can just right click, you can close tabs to the right so that all of those tabs will be closed, and then you can close this as well, and then you can go back, increase the size back to normal, and once you refresh it, you will see that a lot of it has been cleared. So that way you can clear OP as fast as possible. Now we'll be talking about intra-department referrals, so let's go towards that. For that you'll be going to inpatient emergency patients, and suppose I want to do pre-anesthetic checkup for a patient, so I'll have to put intra-department referral for that. So suppose Srinu is posted for surgery and we're doing the basic workup, so we'll go to advice over here, and within advice, if we click on this referral other than PMJ and we choose this intra or inter referral in ESI institutions, you select the state, which is Telangana. You select the location, hospital. Within the hospital you select Sanat Nagar, and specialization, whichever specialization you want to do the referral to. I want to do a PSC, so of course I'll be selecting anesthesiology, and then you can choose the doctor available over there. In my case it is Dr. Venkatesh Reddy sir, and in order to search a name you have to write at least 3 characters, and then the reason you can say PAC for surgery fitness for hydrocele operation under local anesthesia, and then you can just add over here, and then you can see it gets added over here. Once you save and close, it will show up as an intra department referral for them. So that is how you do that. Other than that, there's not much that we have missed. This discharge summaries you can see of patients. You can clear, save, and all of that of particular patients. You can make like a PDF of a patient instead of typing it out. We usually don't give printed discharge summaries, so it's not there. There are a few. Alright, yeah, this is there. So in some departments, especially like ophthalmology or orthopedics department, when the patient is the ESI card holder, we need to generate a leave requisition form from our end so that the patient gets compensated for the hospital stay, so that it does not go into loss of pay. So for that, you just need to click on this MED13. Once you click on this MED13, it will open up a new pop-up, as we'll see. So the MED13 looks something like this. You have the patient details over here, and this is the thing. It is to certify that the other named person was inpatient, including this day by reason of whatever the diagnosis you have added, it will be added over here. And they need to get the medical officer in charge signature and superintendent signature from here. And if they deposit it in their dispensary, then the dispensary will then communicate with whatever the organization that they are working in, and they'll be reimbursed for whatever the day that they could not join in according to whatever ESI policies there are. You can of course print the home page as well using just the print button, and it prints just the home page, so it includes all of the different diagnoses, the health intervention services, if anything was done, all of that, and then along with the patient details, so that is there as well. So that concludes the ESI Dhanwantri module. If you have any other doubts that you would like to ask, or if you want anything else to be covered, drop it in the comments, and I will be happy to guide you. Alright, it's been great. Thank you, and I'll see you next time.